What if lowering your blood pressure didn't require a prescription, but a spoon? Japan's most respected doctor, Dr. Shigeaki Hinohara, lived to 105 and treated patients well past 100. Every morning, he practiced a ritual so healing. Most people wouldn't even notice it. Not a supplement, not a pill, just a simple habit, done before breakfast, that kept his blood vessels relaxed, his mind sharp, and his heart strong. And the secret? It might already be in your kitchen. After 60, your blood vessels don't stretch and flex like they used to. They stiffen, narrow, and without symptoms, your blood pressure quietly rises. Dr. Shigeaki Hinohara saw this over 70 years of practice, and he lived through it himself, aging with the very patients he served. But instead of pills, he followed one ritual each morning. It kept his hands warm, his thinking clear, and his heart steady, even past 100. And now, the science finally explains why it worked. Let's walk through it together. 1. The Artery Reset Ritual. Olive oil and orange juice. You've probably been told that high blood pressure is just part of getting older. But what if your arteries just need a little reminder to relax? Dr. Shigeaki Hinohara, Japan's most revered physician who lived to 105, believed in that reminder. Every morning, he stirred 1 tablespoon of extra virgin olive oil into his orange juice. To many, it looked strange, but to Dr. Hinohara, it was a ritual of repair. Let's unpack why it worked. Here's the science. As we age, our arteries stiffen, like old garden hoses left out in the sun. They lose their flexibility. Blood pressure rises. One reason is a natural compound in our bodies called nitric oxide. Think of nitric oxide like a dimmer switch for your blood vessels. When it's active, your arteries open up, relax, and allow smoother blood flow. But after 60, our ability to produce nitric oxide drops fast. This is where olive oil's polyphenols come in. They're like tiny electricians, reactivating that dimmer switch, restoring the signal that tells your vessels it's safe to soften. In fact, a 2015 study from the UC Davis Olive Center found that just 25 milliliters of high-polyphenol olive oil daily, about 2 tablespoons, lowered systolic blood pressure by up to 14 millimeters of mercury in just 3 weeks. Even more striking, 1/3 of participants reduced or eliminated their blood pressure meds entirely. Dr. Hinohara wasn't waiting for science to catch up. He simply trusted what his body told him. A spoonful of olive oil in the morning felt like it opened everything up. Just ask Frank, one of my longtime viewers. At 71, he was on 2 medications. After trying Dr. Hinohara's breakfast ritual for a month, his doctor cut one of them in half. Frank told me, "It's the only medicine that came with vitamin C and no side effects." So here's a gentle question for you. What's one small morning ritual you haven't tried because it felt too simple to matter? 2. Polyphenol power. Nature's anti-inflammatory crew. Let's look deeper at what makes olive oil such a powerful healing tool. And it's not just the oil itself, it's what lives inside it. You see, extra virgin olive oil is rich in 2 little-known compounds, oleuropein and hydroxytyrosol. These are polyphenols, natural molecules that work like a cleanup crew for your blood vessels. And their timing couldn't be better, because after age 60, many of us are living with what I call silent inflammation. It doesn't hurt. It doesn't show up in a mirror, but inside your arteries, it's like rust, slow, steady, destructive. This low-level inflammation thickens your vessel walls and tightens your blood flow. It's one reason blood pressure creeps up, even if you haven't changed anything. But here's where olive oil's polyphenols shine. In the pre-dimed study, one of the largest nutrition trials in Europe, adults aged 55 to 80 who consumed 2 tablespoons of high-polyphenol olive oil daily lowered their blood pressure by nearly 6 millimeters of mercury systolic over 1 year. Even better, nitric oxide levels increased naturally, showing the body was healing from the inside out. So how do these polyphenols work? Think of them like anti-rust agents. They don't just lower inflammation markers, they actually protect your blood vessels from further wear and tear. They block the damage that aging, stress, and sugar quietly cause over time. I remember Maria, 67, recently retired and battling joint pain, fatigue, and borderline high blood pressure. She told me she felt like her energy was slowly leaking out, even though she was eating healthy. Once she swapped out her vegetable oil for a high-polyphenol EVO and started drizzling it onto roasted veggies each night. Something changed. 3 weeks later, her blood pressure dropped slightly. But what mattered more? I stopped needing that second nap, she said. My legs felt lighter, my brain less foggy. It was like I'd been slowly rusting, and something started scrubbing it away. So, let me ask you, have you ever wondered if your normal fatigue might be coming from inside your arteries? I'd love to know, have you ever switched to extra virgin olive oil for health reasons? Did you feel a difference in your energy or circulation? Drop a note in the comments because what you share could help someone else watching right now. 3. Endothelial repair. Fixing the inner lining. By the time we reach our late 60s or 70s, many of us begin to feel it. Cold hands, slower walking pace, a subtle tightness in the legs. Doctors often call it poor circulation. But the root of it all is something called the endothelium. It's the ultra-thin lining inside your blood vessels, just one cell thick, but it controls everything from how your arteries expand to how nutrients get delivered. Think of it like the wallpaper inside your veins, smooth and flexible when we're young, but with age, that wallpaper gets cracked, inflamed, worn out. And when the endothelium breaks down, your vessels can't dilate the way they should. That's when blood pressure rises, and toes and fingers begin to feel colder, stiffer. Here's the good news. Polyphenols from extra virgin olive oil can help repair this lining. A 2004 study by Perona et al. Tested seniors over 60 who consumed high polyphenol olive oil daily. After just 4 weeks, their systolic blood pressure dropped an average of 14 millimeters of mercury. More importantly, endothelial function, the ability of blood vessels to relax and contract, improves significantly. So, how can you make this real in your own kitchen? Drizzle 1 to 2 tablespoons of cold-pressed EVOO over steamed vegetables or warm grains each evening. Avoid overheating it. The polyphenols are fragile and prefer gentle heat. Helen, 74, started doing this each night with dinner. Her comment stuck with me. I didn't expect much, but after a few weeks, I could finally feel my fingers getting warm again at night. It was like the inside of me remembered how to flow. So, here's something to think about. Where in your body have you started to feel a little stuck? And what would it mean to restore that flow? 4th myth versus fact. Not all olive oil. Is heart healthy? Most people assume if it says olive oil on the label, it must be good for your heart. But what most people don't realize is that not all olive oils are created equal. Dr. Shigeaki Hinohara was very specific. He didn't just use any olive oil. He chose high polyphenol, extra virgin olive oil, stored properly and never overheated, and the research now backs him up. In a 2020 study from La Trobe University, researchers compared different types of olive oil in older adults. Only one kind consistently lowered blood pressure, high polyphenol, extra virgin olive oil. The other oils, including pure, light, or refined blends, no impact on blood pressure. Some even showed markers of oxidation and made inflammation worse. So, why does this happen? Because refining removes most of the polyphenols, the healing compounds we've been talking about. It's like stripping the bark off a tree and expecting it to keep growing. The result? You're paying for the name, but losing the benefit. I once had a viewer, Donna, who wrote, "I was using a big bottle from the store labeled olive oil, thinking I was doing something good. But when I checked the back, it had no polyphenol content listed, no harvest date, just a bland blend. I switched to a cold-pressed bottle in dark glass, and my legs stopped swelling within 2 weeks. So, here's your gentle nudge. The label may say olive oil, but your arteries know better. If you're going to use it for healing, make sure it's extra virgin cold-pressed, stored in dark glass. And ideally, from a harvest within the past year. How olive oil blocks arterial damage. Let's talk about one of the biggest silent drivers of high blood pressure after 60, oxidative stress. It's what happens when unstable molecules, called free radicals, start attacking the inner lining of your blood vessels. Picture it like an acid rainstorm falling on metal pipes. Over time, the damage builds, vessels harden, elasticity fades, and your heart has to pump harder just to get blood through. Now, here's the good news. High-polyphenol olive oil acts like an umbrella in that acid rain. These polyphenols don't just reduce inflammation, they also neutralize the free radicals themselves before those radicals can scar your arteries. A 2020 study from La Trobe University confirmed this. Researchers gave seniors either high-polyphenol olive oil or low-polyphenol blends. Only the high-polyphenol group saw measurable drops in blood pressure. Why? Because their oxidative stress markers dropped, meaning the olive oil was actively shielding their vessels. The low-polyphenol group? No changes at all. That's why it's so important to check your bottle, not just for the word extra virgin, but for these three things: a polyphenol level above 300 milligrams per kilogram, cold-pressed production, stored in dark glass to prevent light damage. George, 76, had been using canola oil his whole life. After learning about oxidative damage, he swapped to a Spanish EVOO with 320 milligrams per kilogram polyphenols. 3 weeks in, he wrote me, "My dizziness after standing up is almost gone. I didn't expect that. I just thought it was old age." It wasn't. It was oxidative stress. And his body was finally catching a break. So, before we close, here's one final thought. If free radicals are the storm, what's protecting your blood vessels from the rain? Maybe the answer to lower blood pressure was never about doing more. Maybe it was about returning to something gentle, something ancient, something daily. Dr. Hinohara didn't wait for symptoms. He simply gave his body what it needed, every morning. So, let me ask you, if one quiet habit could help your circulation, your energy, even your sense of clarity, would you give it a place at your table? And if this spoke to you, if it reminded you that healing doesn't have to be loud, then I'd love for you to tap subscribe. Because every week we share timeless tools for aging well, drawn from the lives of those who've lived longest. You're not late, you're right on time.